This was just a recap of what I've been saying about how you approach pathology reports. So one of the things is when you see a pathology report, the question is, well, what do I do with this bit of, how do I sort of approach it? It's just all this stuff on the page. And so I think it's good to have an approach to reading pathology reports. Firstly is to check the patient details, which is obvious, but there's been a lot of treatments done on the wrong patient. I'd also say put some effort into reading the results. I had someone complain to me that they misread one of our cystic fibrosis results, and they said, I actually read it upside down on the secretary's desk when they were looking across. So actually read the bit of paper, see what context you are, what's the question, and then typically when I look at pathology results as a pathologist, once you've worked out what the sort of question's likely to be, I usually just think of, well, what are the main abnormalities, or what's the striking things here? Sometimes the striking thing is that something's normal rather than abnormal. And typically when I'm trying to communicate pathology results to someone else over the phone or talk to them about it, you give a little bit of a patient vignette, if you like, to say give the context. Then you say what the situation is. So you might see a raised gamma GT and a raised alkaline phosphatase with a mild ALT elevation or some little description. But then the most important thing is really, I think, certainly as pathologists and probably as medical and nursing practitioners, we're really storytellers, is my sort of take on things. And what we're trying to do is to capture knowledge and transmit it to other people by telling stories to other people. And so when we're communicating, it's very important that we have, this is the background, this is what I see in the results, and my story about it that links it all together is that this is a intrahepatic cholestasis because of the isolated elevation of the biliary markers with only a mild transaminase increase or something like that. So basically you're talking about a story that will communicate that information, and also a story that sort of makes sense to you. And I think that's when we're going through vignettes and cases and patients, when we remember a patient, we don't remember necessarily just their cholesterol, it's the whole story about that patient and the cholesterol and how that worked out for them. Also in terms of artificial intelligence, which is big now, there's Roger Schenck. He was a Yale University artificial intelligence guy in the 90s, but their approach to artificial intelligence was to say that if you want to say, well, we'll make an artificial intelligence like a person, if we mainly deal with stories, remembering things through stories, communicating things through stories, understanding things through stories, maybe as the artificial intelligence will also have to operate in a story sort of approach. That was actually called the Yale approach to artificial intelligence. It's sort of gone a bit out of favour in the straight mathematical crunch the neural network sort of approach, which is more MIT has sort of taken an ascendancy. But I think it's important as practitioners to think about stories as a way of remembering things and the way of communicating things.